Hello, welcome to this event. My name's Mark Doughty. I'm a senior consultant at the King's Fund. I work in leadership and organisational development, and I'm really pleased to be here today. I'm chairing this event, and the focus today is going to be on looking at how we use inhalers remotely and how this has challenged clinicians and patients and colleagues at a time where we've been working online more and more, and the new lessons that have emerged from delivering health and care services at a time when COVID-19 has really reshaped our understanding and experience of the human element in healthcare and our increasingly greater coexistence with digital technologies. That's going to be the key focus. I'm going to give you a little bit of the context of this in a minute. But firstly, I really want to thank GSK for sponsoring this event. Without GSK, we would not have been able to do this. So thank you very much, GSK. I would also like you, the audience, to submit any questions during this event via Slido. You should be able to see a box in the right-hand side of this video, which is where you can submit any questions. Some of our speakers are going to be online watching live with you and will be able to respond to any questions that you put up there. So I would really emphasize and encourage you to do that. We will also be putting some poll questions and word clouds via Slido to you, the audience. These will flash up at various points during the session, and we would really encourage you to pay attention when they do come up. Finally, on this, you can follow this conversation via Twitter using hashtag KFOnline, or one word, and take a look at some of our resources that we've linked to this page as well. So after that brief introduction, I'd just like to invite my fellow panelists to introduce themselves. So if I can just go around my screen, and I'm going to just speak to the first one that comes up, which is Andrew. Would you like to just introduce yourself briefly, Andrew?
Hello there, my name's Andrew Kamela. I'm a senior analyst at the Asthma UK and British Lung Foundation partnership. I do plenty of patient research, and during the COVID pandemic, I've run a series of surveys finding out how COVID and coping with how care has been operating has affected people with lung conditions over the past year or so.
Thank you, Andrew. Welcome. Shakila.
My name is Shakila Riaz. My profession, I'm actually a clinical pharmacist, but I'm representing the patients on this panel. I work with Primary Care Respiratory Society. I'm actually on their panel for patients, so I've done quite a lot of patient representative work throughout the UK. I've sat on quite a few panels just to represent patient views on respiratory. I've got two children that have asthma. I also have asthma myself. I've been an active member working alongside Asthma UK for a very long time. And I'm hoping that my views will help make a difference today on this panel.
Thank you very much, Shakila. And Andrea.
Hello, I'm Andrea Lever. I'm the Associate Country Medical Director at GSK UK, and I'm a former NHS GP. And I'm here because I've been supporting with GSK's activities to help healthcare professionals and patients during the pandemic.
Thank you, Andrea. And finally, Danielle.
Hi, I'm Danielle Reesby. I'm an assistant practitioner in a rural Lincolnshire practice, and I've been working during the COVID pandemic on mainly respiratory reviews and incorporating new technologies into the consultation process.
Well, thank you everyone for your introductions. Before moving on to the questions, I just want to set the context for this particular event. Clinical practice certainly requires trust, and it requires a flow of communication between patients and clinicians. But it also requires a flow of communications among staff working in different pockets of the system, with the aim to provide the best possible care for each person. Now, COVID-19 has really tested our collective understanding of the patient-clinician relationship, and transforming it overnight into a remote online one whilst also changing fundamentally the ways that staff might come across in when they're working in healthcare in a digital environment. It has been really testing and challenging, and it's because of this that it's partly because of this that we're doing this event today and focusing on the use of inhalers as being a target for understanding what it means to have an online clinical patient relationship. And our questions are set up to help explore that. So I'd like to move immediately, if I can, to the first question for our audience and our panel, sorry. So my first question, and I'm going to give it, Andrew, it's going to come to you. So heads up that you'll be the first one to ask to answer this. Are we going to go back to face-to-face consultations? Only once it's possible. And what role do you see for digital consultations once we go back to, I won't say normal, because it's going to be, I think you would probably agree, a new normal. But are we going to go back to face-to-face and not do any more digital consultations? I wonder what you think.
Well, Mark, I'm glad you said the new normal, because I very much doubt things will go back to how they were in February 2020. I think too much time has passed since then, and the majority of people with lung conditions have experienced some form of remote care since the pandemic has started, through a remote consultation or viewing their online patient record or something like that during that period. So yeah, it's going to be, I think it will be a hybrid of what we've learned during the pandemic and also what we did before and what people were used to before the pandemic. So I think there's, in terms of the role for digital consultations, I think there's some sort of big benefits of these, but also some things to be more mindful of. So in terms of positives, I think they've proved popular for parts of the respiratory population. I think they've been more popular with shielders who've been able to access healthcare services without having to leave the house when they've been instructed not to leave the house. And this may continue during flu season, even without sort of shielding advice or staying at home advice. People with lung conditions can be very wary during flu season because, catching a cold or flu can often mean a spell in the hospital. So having access to remote care during then especially will be really helpful, I think. There's also, a chance that the flexibility could increase attendance at asthma appointments. Being able to sort of, take a call in your own time rather than having to have time off work or juggle other responsibilities to, have a chat with your GP or asthma nurse about your condition. That could help improve access. And also, it could be useful for those who are managed in tertiary care for severe asthma, who previously have to travel to one of the bigger cities to access care there. We've seen a sort of rise in home administration of biologics, and also it could save what can often be a whole day spent going to an appointment. However, I think there's a balance to this. I think people with lung conditions need to have a choice of what medium they access their care on. Our research has found that a lot of people with asthma, so this is in our annual asthma survey report, which was published in early May, found that a lot of people with asthma, an estimated 1.3 million, hadn't seen a healthcare professional for a face-to-face appointment in the past year. And although there's been huge efforts to maintain the quality of care, there's certain parts of this which are much more difficult to conduct remotely. Things like inhaler technique checks. It's much harder to do that to the same quality remotely as it is face to face. So, I think there's a real job and a thing to be mindful of, maintaining the same quality of care and making sure that the people who really do need face-to-face appointments, and people may feel more comfortable talking about their lung condition face-to-face, can access that when they want to and when they need to.
Thank you, Andrea. Andrea, is there anything you'd like to add to what Andrea said?
Thank you, Andrew. I was really interested listening to that, and I think some of the things that I heard from that is about flexibility and trying to sort of perhaps keep the best bits of what we have seen in this last year. I think, as you mentioned, that there are harder to access patients who may not, for example, asthma patients who themselves don't attend for appointments or arrange appointments, that can now be seen more flexibly at work, which I think is a great thing. And I think it just emphasises that there's no one solution that will work for everybody, and we just need to find the best solution for each patient, and perhaps also not prejudge, because I think in one of the initiatives that GSK has been involved in, we've found that even with COPD patients, we've had a high engagement, and that population tends to be on the sort of older side than asthma, and yet we've still seen a high level of engagement remotely. So flexibility does seem to be the key.
Thank you, Andrea. And Shakila, I don't know if you, as part of your care during the pandemic, was being referred to your physician, or your daughters were being referred to their physicians online, but I wonder what your experience would be, or you would like to see be, as we go back to more face-to-face. Would you like to continue with online consultations? And if so, why?
I think patients should actually have a choice, but then it should be down to the clinician. I think it's a good thing where I know some surgeries where I live, they're actually triaging patients. So they triage them through virtual consultations, and if they feel they need to see them personally, they will invite them down. And I do feel that should kind of still continue, because I think it's really important that those patients that don't need to be seen face to face are not clogging up the appointment list. They can be dealt over the phone very swiftly, really. So I think a virtual consultation should still be there as an option for patients to choose from. And I think we've come a very long way. I know initially like you said, it was an overnight going into virtual consultations because of the lockdown, and it was a huge struggle for a lot of primary care and secondary care settings. And I don't think we should totally shut them off. Totally, virtual consultations, they should still be there as an option, because you never know. We've had one lockdown, but you can't foresee the future. So I think it's a good idea to have them embedded still in there and give patients a choice.
Thank you, Shakila. And Daniel, any thoughts?
So from my point of view, working at the practice that I do, I think it would be a massive shame to go back to fully face-to-face consultations. I think we've found the remote reviews and the texting services to really improve the quality of care for our patients. And although we work in a practice where there's quite an elderly population, we've not found that to be a hindrance at all. And we've actually achieved over 95% in-date reviews for our asthma patients, which is quite an improvement actually from previous years. And I think that's definitely because we're able to reach more patients via remote consultations than we can face-to-face.
Andrea, I'm going to focus this question for you. What are the conditions that should be in place in order for a remote consultation to work? Yeah, I'll leave it just at that for the moment. Any thoughts, any reflections?
So I think for remote consultation to work, I think it's important that both the healthcare professional and the patient are prepared for the consultation, and there are many ways that this can be done. For example, GSK has sponsored what's known as a Florey questionnaire with AccuRx, and what this does is it's sent out via text message to patient with COPD, and they can fill in their CAT scores and their MRC scores, and so that not only can the healthcare professionals prioritise who they see, but when they actually speak to the patient, they already have a lot of the information with which they'll be able to make some informed decisions, and also spend more time talking to the patient about their concerns and expectations. So I think it's about preparing people and providing them with the resources and tools. And I think A lot of this is happening now with GSK has a remote review hub where there are tips and cheat sheets and things that people can use to help them. I think it's about, we're still learning, but I think it's about sharing best practice, but preparedness on both sides I think is important for each consultation.
Thank you. So Shakila, to you, I'd like to ask, what are the conditions that you think should be in place for patients in order for remote consultation to work effectively?
I think the most important thing is everybody's got to have access to an iPhone, to an internet, to access the service. And I know that there are still quite a few minority that don't have that access, so will probably kind of lose out. Another thing I feel is you've got to have that trust with the clinician who's taking the decision to obviously give you advice over the phone without seeing you face to face. So the trust, the compassion should be there as well. So you obviously want to feel that, you know, the other person, the clinician on the other side, I mean, they may just be hearing your voice. It might not be like a virtual consultation face to face over the internet. So you just want to be made felt that the person on the other side is actually acting in your best interest and will give you the appropriate treatment. And so I think the trust and the compassionate bit is actually quite important in these consultations.
Thank you, Shakila. Andrew, have you anything that you'd like to add to this?
Yeah, just to echo Shakila's points there about you know, not wanting to exacerbate existing inequalities and making sure, you know, we don't miss people who don't have the same kind of digital access as others, and also being able to trust that, you know, the infrastructure is solid and they can speak confidentially on it. A couple of other points I think are important here. I think support for healthcare professionals is needed. This kind of change has happened at an incredible pace and during an incredibly testing period. So, you know, as mentioned earlier, things like inhaler technique checks are much harder to do remotely. And the Task Force for Lung Health has produced a guide to help healthcare professionals to support with this. So I think sort of developing that kind of evidence base and knowledge about what the best practice is to perform care remotely will be really important if we're going to carry on providing care remotely as we are at the moment. Again, finally as well, I think, you know, it's making sure that there's patient buy-in to this. You know, our research, again, in the annual asthma survey, found that a lot of people, the majority of people with asthma didn't think the care they were receiving remotely was of the same quality as face-to-face care. And the main reason given was that they didn't feel as comfortable discussing their asthma in that setting. You know, this could change as we kind of open up and people will be getting more and more used to having care remotely. But I think people with asthma and other lung conditions need to be kind of taken along with this journey, and more research will be needed to make sure that, you know, that they're getting the care that they need and of, you know, the same quality as they can expect face to face.
Thank you, Andrew. And Danielle, have you anything to add?
So for remote consultations to work, I think it's really important that the clinicians have all the resources that they need. So I know pharmaceutical companies, we've used GSK's resources on their website for sort of, as Andrew was saying, the cheat sheets and tips and hints of how to make remote consultations work. So I think it's definitely a case of clinicians using all of that information that's out there for them. And I think for patients' point of view, I think obviously they have to have the technology, which we found the majority of our patients do, but also they just need to have the support from the clinicians. So, you know, sometimes things don't always go right first time, but it's just to have that support and to work with the patient and to provide them with really great resources so that they can better manage their condition from home. So we use a lot of the Asthma UK resources, so inhaler technique and breathing exercises for COPD patients. And this is all really easily sent via text message. So we can send them the link and they can get involved and do these things from home. And I think that's really benefited a lot of our patients.
Before we move on, I just I too am someone who lives with a number of long-term conditions, and I've had at least 3 of my ongoing consultations online during the last year, and I've been very fortunate for 2 of those consultations. It's been with a clinician that I've had a longer term face-to-face relationship with. And I really noticed a really subtle difference between somebody I'd already had a relationship with and somebody who came along and filled in for my usual clinician online for the first time. And I was fortunate. And I say this because I think this clinician they either had a natural affinity with working online with patients. This was a video call, so it wasn't a telephone call, so I could actually see this person. But what they brought to it was a real presence. That's all I can say. A real presence, a real sense that they were there online for me. So I really felt seen, even though it was online, and heard by this person. So there was something about a real art as well as a skill to this. And I would echo something I think that Shakila said, that that trust built up because of how this person appeared on the screen. I really felt a connection. So I would really echo to clinicians out there, and please do not hear this as telling you to suck eggs, but that sense of really focusing on that relationship as well as offering advice and support is so important, I think, and probably sometimes maybe even more so if you've not had a conversation with the patient before. Okay, let's move on to the next question. And this question is for you, Shakila. What lessons are you going to carry from your experience of being a patient along with your children during the pandemic and receiving online consultations during this period? Is there any surprises that emerged for you? Is there anything that came up that you are you going to take forward in terms of suggestions that you might be offering to other patients and other clinicians because of your own experiences?
Hi, yeah, just like I said before, I think a good internet connection and obviously portable smart devices so you can access the video call to a clinician. I mean, that's the closest thing you probably get to a face-to-face consultation. I think another thing is when the lockdown happened last year in March, it wasn't as good. The care that I actually received wasn't as good as it is now, because I think the platforms have developed a lot and the clinicians are a lot more experienced in dealing with the consultations, because I think it's actually been quite hard for the clinician. Um, I mean, for patients, it's been a totally different experience as well. I've had some good experiences, some bad, but I think it's evolved in a sense that now virtual consultations, video calls are a must, and I think they're embedded in our lives day in, day out, that they've just become normal as a normal routine. Because the video calls, I mean, we are not just to clinicians at the moment, we're video calling friends, family. So I think those that didn't have smartphones have actually gone out of the way and bought smartphones and laptops so they can communicate with their families. And I think the most important lesson that we learned out throughout COVID is, just like I said, is how important internet is. And I do feel for those patients that don't have smartphones, obviously can't afford the internet. And I just feel that there should be some kind of help for those people, and also putting the equation onto patients that can't speak English or that English is not their first language. How do we deal with them? Obviously, video consultations, do we have a representative? Which way around to protect the patient's, confidentiality and trust? How do we deal with that? So I think those are the major lessons that obviously I've learned as a patient. In relation to my children, I think the consultations they've had have been absolutely amazing compared to the experience that I've had. I think the consultations from the GP settings have been much more effective than the consultations in secondary care. But I'm sure they will evolve in time. I think with the pressures on the hospitals, I think they kind of lacked that the full-on virtual consultations and video calls. So I think that's kind of quite important that we get the secondary care video consultations just as good as the primary care setting.
Thank you, Shakila. Andrew, from your perspective, from any research you've seen or any feedback you've got, are there any surprises, any lessons that can be learned from our experience of online consultations over the last year?
Yeah, I think there's a couple of things that have surprised me from what I've learned over the past year. I think one surprise is about how fast the pace of change has been. Things don't always move particularly quickly in health policy, but the sort of care models are kind of turned on their head in a matter of months, and obviously through necessity. But I think that's still kind of worth taking stock about. I think also something that I found really interesting and we'll need to sort of keep an eye on in the future is how people have interacted with accessing care. Our research has shown that, as well as a lot of people, changing the way they're getting care by doing it remotely, a lot of people are very reticent to use NHS care that they need for their lung conditions. So, this could be, avoiding setting up a GP appointment when your asthma symptoms are deteriorating, or not calling 999 if you're having an exacerbation, something like that. And we've dug a bit deeper into this to try and understand it, and people have told us that they've not wanted to access care because two reasons mostly. One, because the risk of COVID is there if they do go into a hospital or other NHS services, but also not feeling like they don't want to be a burden to the NHS when they know how busy and difficult the time has been for the NHS. We've also seen this manifest in statistics about GP appointment rates and emergency admission rates for respiratory conditions. So I think that will be something really interesting to keep an eye on, to see how has that relationship between when people access care changed, and will it go back to what it was like before. As well, something interesting again, sort of a bit of both of those points. I think people's behaviour changed quite quickly during the pandemic. You think, again, early 2020, when did you see anyone wearing a mask? And now you see it all the time, and the majority of people are wearing masks, at least in public places. And I think it'd be interesting again to see, will that continue? Will people be more aware of their respiratory health and continue using these sort of interventions here that may protect themselves from other infections? So yeah, this could also have an impact on the care utilisation and people's relationship with accessing care.
Thank you, Andrea. So, Andrea, what lessons are you taking away from your experience over the last year as we've worked more and more online, and we've worked more and more in terms of focusing on a relationship that is a clinician patient relationship that is built online? Any reflections or thoughts, any surprises that might have emerged for you?
Thank you. Yes, I mean, I think we've realised that we can move at pace, and we can adapt and use new technology. I think that people are exhausted and burned out, and learn that people need more support in perhaps instigating prioritizing of reviews. There is a lot of technology out there, but not everybody has had the support to actually access it, both from a patient point of view and also a healthcare professional point of view. I think we have an opportunity, perhaps over the summer, where the rates of COVID have declined, to perhaps look at prioritizing annual reviews and using some of the software that we have available. For example, there's a Keel toolkit that was developed by the Midlands Practice Pharmacy Network and Prescribing Decision Support and Centre for Medicines Optimisation at Keele. And this uses a technology to help prioritise based on avoidable risk factors. So I think we need to support people, we need to support patients, we need to support the clinicians, as say, who are burnt out. But I think we've learned that we can use this technology, and we should be open to using it for all people and not judging whether people will or will not be able to use it. I think I mentioned before, the elderly are quite keen and happy to use it. I think, as Sakila was saying, a lot of people have now bought smart devices to communicate with their relatives, and we have an opportunity to use this going forward into the next winter as well.
Thank you, Andrea. Danielle, from your perspective, what lessons will you carry from the experience of working through COVID with patients and clinicians?
So I think the lessons that we've learned as a practice is that we've been able to engage with our patients more frequently. So we are able to keep sort of a closer eye on their condition and the management of their condition. So we're able to send them these surveys about their asthma, which contains the ACT score, at more regular intervals. I think also it's a really key point to make that I think patients need to be more aware of their own condition and to be given the resources and information to educate them on how to better manage their condition. So again, Asthma UK has some great resources. And I think it also just highlights how adaptable we are as the NHS. So we've worked during COVID when there's massive strain on the workforce, but we've still been able to roll out these new technologies. So I think if we've been able to do that during the stressful time that we have, we could definitely use it past the pandemic, and again just incorporate it back into these face-to-face consultations to just give better quality of care to patients.
So my next question, and this is for you, Andrew, how do you think we can prepare staff and patients for the transition into more hybrid forms of care if, and I expect this is going to be the case, digital consultations are here to stay going forward? Andrew.
Yeah, this is an interesting one. I think what's really important here is understanding what patients and healthcare professionals' expectations are of how care is going to change. We talked a bit about how things have changed at a really rapid pace. We haven't really had enough time to sort of digest what has happened and understand what people really want. So I think in terms of preparing staff and patients, I think it will be, finding out more about what they want, what's worked well, what hasn't, and then learning from that to develop a way of doing digital consultations that picks up the best from what was done before the pandemic, and also the really important things that we've learned over the past year.
Thank you, Andrew. And the same question to you, Shakila.
Hi, yeah, I totally agree with Andrew. I think your patients, because the way everything's moved so fast and swiftly throughout COVID, I know some patients have struggled to access video consultations, to access certain sites because they've not been shown or given enough information to access them. One example is, how do you check a patient's inhaler technique? If a device obviously is, I know there's been a lot of patients, including my children, that the asthma has actually exacerbated throughout COVID. I don't know if that's the weather or the whole situation or the whole change of children being at home all the time and being on the devices. It could be all sorts of reasons, but one of my child's inhalers did get changed. I mean, it's kind of fortunate for them that I'm a pharmacist. I know I would be able to advise them. I can access the instructions online, the videos online, but I do feel for those patients that cannot access, that do not have that information, and they're just kind of left with that. The new inhaler's been prescribed by the clinician, but they've not been given the correct information or that demonstration how to use the inhalers. So I think that's quite important. They need to give the patients the right information and give them that help to access the information that they require.
Thank you, Shakila. Andrea, do you have anything to add from your perspective?
Thank you. Yes, it was really interesting actually hearing Shakila mention from her own personal experience being a pharmacist, is that I think, you know, training and supporting people in the use of digital technology, I think perhaps using more of the push technology, sending out questionnaires, as I mentioned before, but also potentially sending out links to the videos so that people have easy access for video demonstrations on how to use an inhaler. But then that important link also with the community pharmacists, you know, may there be a role when people are collecting their prescriptions that is a point at which inhaler technique is demonstrated. So I think, you know, going back to Andrew's point, we don't yet know a lot of the things that the best ways to do this in future. It's still evolving, but I think we have a lot of really good information and a lot of opportunities to incorporate technology more in the future.
Thank you, Andrea. And on that, that you led really nicely into the next question I was going to ask, actually, and I'd like to start with you if that's possible. Have you got any examples of great respiratory care that has been provided remotely?
Thanks, Mark. Yes, well, the experience that we had at GSK last year as we headed into the pandemic was that we had a COPD patient review service that was delivered by clinical pharmacists, and we moved very rapidly to what we called remote review, and then remote review, where the pharmacists were working from home, the patients were obviously at home, and very, very quickly dealing with the legal issues, privacy, etc. We were able to deliver a high standard of care with people learning as they went, but as we mentioned before, using videos from the Asthma UK website on how to correct inhaler technique, etc. And the feedback was really good, and the number of patients seen was significant, and so a great deal of high quality care was delivered even in the early phases of the pandemic. So as I mentioned before, I think we've shown that we can work at speed, both in the pharmaceutical industry and also in the NHS. And I think we should, where possible, try and capitalise on that.
Thank you, Andrea. Shakila, Andrew, Danielle, do you have anything that you'd like to add to that in terms of being on the receiving end of great care, or witnessing or knowing in terms of good examples of respiratory care?
So within the practice, we've found that using these textual services, we've been able to improve patients' asthma control, and that's all been remote. So we've been able to enhance patients' treatment, change their inhalers over, sort of teach them new techniques, and in the end of all of that, they've had an improved asthma control test score, and that's all been remote. So I think it definitely shows that, you know, it doesn't hinder you from giving good quality care to patients. As I say, in some ways we found that it's been a better way to control people's asthma and to manage their condition. I think also a lot of our patients nowadays have access to medical equipment from home. So we found that a lot of our patients have bought pulse oximeter machines, so they're able to test their sort of oxygen sats from home. And that's largely, I think, because of the COVID pandemic. And all of these things sort of help to better manage patients from home. We've also been prescribing a lot of peak flow meters. So usually that would be done in the surgery. You know, patients would come in and do their peak flow measurements, but patients now have these from home, and it's quite a simple piece of kit to use. And you know, I think patients should be getting into the habit and the routine of using these more often to keep an eye on their asthma control from home, and as I say again, to better manage their condition themselves. So I think gone are the days when patients would take a whole day off work to come in for their face-to-face asthma review, you know, to blow into the peak flow meter, when they can quite easily do it from home and have a you know, a telephone consultation or a, you know, a digital consultation. And I think it gives the patients a lot more trust in the clinicians, so they feel more empowered that they can control their condition from home, and I think it in turn makes them more likely to be more compliant with their treatment, and also to think about ways in which they can, you know, benefit themselves.
Shakila.
Hiya. Yeah, like I said before, I've had kind of I feel I've had excellent care in certain settings and not so good care in other settings, but so I'll go with the best care that I feel I've had. I myself had a quite a bad exacerbation of asthma, but the reluctancy of attending the hospital, I think that was there because of the bad press that was going around. I won't go into detail. I think it kind of does set in your mind, and plus myself being high risk, I do have severe asthma. I didn't want to expose myself to any settings, obviously face to face, because I'm actually really prone. And for me, I think it's kind of a good thing that everybody's wearing masks, because prior to COVID, I was working in community pharmacy, and I only used to work a weekend, and every time I got home in the evening, I was actually feeling really poorly. This is how prone I am to catching infections and colds of people, just airborne, just normal infections. So I think the thought of catching COVID was actually quite devastating for me. So I think the primary care, my GP was actually really good. And just like yourself, Mark, I've got this kind of a good relationship with one of the GPs who actually went out of her way to give me on the spot treatment straight away. She returned my call, gave me a video consultation, checked my respiratory rate, checked all my observations, and I'm lucky enough to have most of the things I need at home, the oximeter, the stethoscope. So she was kind of just guiding me what to do, what to look for. In the end, she gave me the treatment that was required. But even then, I just felt that the sense of care, and there was a lot of compassion in the way she spoke to me and the way she dealt with my scenario. And even that, as she actually did a courtesy call from every 1 to 2 weeks just to see how I was getting on. And in every consultation I had with her, she was always checking on my mental health as well, which I think is a huge factor. And I would advise the clinicians out there, especially, I mean, it's probably for a lot of people with various long-term conditions, is always kind of try to drop in that they try to check in the mental health of a patient when doing consultations, because that's kind of remains dormant and patients don't always bring it up, and it does, I think it does exist in a lot of patients with long-term chronic conditions.
Thank you, Shakila. Andrew, have you got any experiences of great respiratory care online?
I'd say more care that our sort of research has found out about. I think I mentioned earlier about remote care for people with severe asthma on biologic treatments. You know, this was a change that was sort of in the pipeline before the pandemic and has speeded up a bit during that. So, you know, this is being able to home administer what is usually an injection at a large hospital in a bigger city. Our research has shown that, you know, this has proved popular with people with severe asthma for the convenience. You know, quite often this means they don't have to make a trip of, you know, 50 miles there, 50 miles back, which can be a whole day, and can do this at home while, you know, maintaining a relationship with a clinician that they've got to know well. So, you know, I think, you know, that's, you know, to my understanding, that's an example of where, you know, something that was kind of being filled out has been, you know, accelerated and is proving popular with patients.
Thank you. Thank you. We have a statement here that's come in through Slido from one of the members of our audience, and I'm going to just read this out because I'd be very interested to know what our panel think of this statement, whether it resonates, whether there's any thoughts you might have about it. And the statement is, technology has a crucial role in empowering people to take ownership, manage, and have choice and control over their health and well-being. All they need is to have access to it. So I'm really struck by that statement, and I'm wondering, what do any of our panel have any thoughts? I throw that open.
Yeah, I think this is a really true statement. So I think nowadays there's so much information out there online that patients have access to, and I think partly it is about them being aware of where they can find this information. So for clinicians to sort of direct them to useful resources. So again, like the Asthma UK website, and I think yes, it's all there at their fingertips and their disposal. And you know, we can teach patients how to use their inhaler in a face-to-face review, but they might then go home and completely forget what we've taught them. So if we're able to send them a link with a video that, you know, demonstrates how to use their inhaler, they can go home and look back on that time and time again. And if they have any problems or they have any questions, they can sort of use those digital tools to help them. And obviously they're more likely to retain that information past that 15 minutes, however long we get in a face-to-face consultation. So for us at the surgery, you know, there's a lot of different members of staff and they all have different experience of technology and using that for work and for personal as well. So it took a little bit of time to get everybody on the same page and up to the same sort of standards with the remote consultations. But I think it just took that one person in the surgery who was quite confident, you know, to teach the others how to use it. And it did not take a great deal of time. You know, I think in the early stages, there's bound to be a few teething problems, but we were just surprised at how quickly everybody in the surgery picked up these new technologies. And I think personally speaking, I don't think I could manage without them nowadays. I think they're really, really beneficial. They save us a lot of time. They save the patients a lot of time. And again, going back to the point, I think they do really improve the quality of care for patients.
Yeah, so I think access to technology is incredibly important, but I think there's a bit more to it than that. So I think of access to technology, I think about something that happened with my grandmother. My parents bought her a mobile phone, this is about 10 years ago or so, and we thought, you know, if she gets in a scrape, she can give us a call or something like that, and we can just be more in contact with her. However, you know, we tried to call her and it didn't go through, and that was because she said, well, I don't switch my phone on because nobody calls me. So I think it's a matter of, you know, as well as having access to that, being able to, you know, make sure people know how to get the best out of the technology. You know, if this is through patient guides, patient engagement, well-designed applications and technology, that will be, you know, just as important as having, you know, the device needed in front of them.
Yeah, and before I go to the others of you, I just want to add something there, Andrew. You've said something that really resonated with me, because I've only just had this conversation a couple of days ago with my mother, who's 88, and we were talking about her use of her phone, and she'd known I'd recently come off a consultation with one of my clinicians, and she said, "Oh, I don't know how you can do that. I wouldn't do that." And I was saying, Mum, it's quite easy. You know, you can come on. You know, I don't like going online. No, 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 no. I'm only going to see my GP if I can get to see them. I might go with the telephone. I might, but I'm certainly not doing a video call. I'm only speaking with my GP. And I think we definitely need to be aware of not only different groupings, but ages as well. And we know that there are people of a certain age who absolutely have embraced technology, and there are others that really want that face-to-face consultation. So thank you, Andrew, for bringing that up. Shakila or Andrea, do any of you have any reflections on that statement that was given? Shakila.
Hi, Mark. Yeah. I think I agree with Andrew and yourself. Age does have a big impact on accessing the healthcare. But on the other hand, I think quite a lot of the elderly require a kind of relief that they didn't have to personally attend a clinical setting. Obviously, because of COVID, they probably didn't have the family help or somebody to drive them there because of the restrictions. And I do know personally that obviously I've got elderly, I've got a grandma, and she was actually quite relieved because she used to hate going out. And I think that was quite she probably wasn't too happy with the video call, obviously. I think the elderly are quite reluctant with video calls because they can actually see themselves and it just put them off. But she was happy she didn't have to go out the house. And I think COVID scared the elderly like mad. They just wanted to be isolated at home. So I think technology has got a huge part, and patients they've got to they can take care of themselves if they have the help and the right equipment. And I think a lot of elderly have become really kind of really good with the smartphones and devices, and they're actually quite enjoying it. So I think that's a good thing overall.
Thanks, Shakila. Andrea.
Yes, thank you. It's really interesting listening to Shakila and Andrew on that because, you know, it very much resonates with me about the, you know, the mobiles turned off situation. But also sort of interestingly, GSK sponsored a round table last year, and the attitudes for technology was discussed in the over 65s, and there seemed to be a sort of pervading attitude that they weren't often offered virtual services because of the assumption of their lack of willingness to engage. And I think as everyone has pointed out, it's different people have different needs, and some people will engage. And certainly, as I mentioned before, with the the AccuRx COPD surveys that have been sent out, we've had 61% completion rates of these surveys, and in the COPD population, that would suggest that a lot of the older patients are happy to engage. But I think it's training and help for everybody, healthcare professionals as well. I mean, I think, you know, not everybody is comfortable with technology, no matter what age they are. And I think people need support and training, both patient support and healthcare professional support.
Thank you, Andrea. We've come now to our closing remarks, and I would really appreciate uh, the four of you to have an opportunity to think about what it is you would like to leave our audience with around this important topic. Have a moment just to think about the statement you would like to make, which you feel sums up your position, your thoughts about this in a way that really communicates to our audience. You've got about a minute each. So, and I would like, let me think. I would like, no, I'm gonna let one of you start. Who would like to start? Andrew.
Sure. So I think this has been a really interesting session. I think some sort of key points from me are that, you know, moving forward, you really do need to include patients in the design and delivery of future remote care. You know, this has been exceptional circumstances where we might not have been able to do this as much as desired, but going forward, if we are going to embed the changes we've seen, it does need patient involvement at every step of the way. I think it's also incredibly important to make sure there's parity in care quality as much as possible across the country. And, you know, all of the sort of really important elements of respiratory care are conducted both face-to-face and digitally as much as they can be. And, you know, our research has found there's a fair amount of variation in what has been offered from, you know, GP practice to GP practice. So I think that will be a huge challenge to make sure that everyone's receiving excellent care. And finally, yeah, I think I've said it before, but you know, we're not going back to what we had before. So the challenge is to, you know, learn from what happened under, you know, really fast pace of change, and embed what worked really well and continue to learn about that for the future.
Thank you, Andrew. Shakila.
I think virtual consultations, they should still be there in the background, even if they're not being fully, they won't be fully used. I think once the COVID has calmed down and we are getting face-to-face consultations, I think they should still continue to develop in the background, because I think now COVID has changed a lot of patients' mindsets, and I know a majority of them would still agree to be seen virtually rather than face to face. I just want to touch on a point what Andrew said previously. I'm actually on a biological treatment myself, and where I had to go into secondary care setting for my treatment, and it took about 2 hours, and it used to take me 30 minutes to get there, and it saved so much time, and I was actually relieved when I got the home care treatment. So I think virtual care definitely has to carry on. I can't see it stopping, and I don't think it should stop.
Thank you, Shakila. Danielle.
Yes, so for my sort of final remarks, I'd just like to say that I really do encourage all clinicians out there to really embrace these digital technologies. You know, we found them to be really beneficial, and there's so many resources out there that sort of can show us how to use them and how to adopt them in our day-to-day practice. And again, going back from what I said in the beginning, I think they definitely serve a place in the management of a lot of long-term conditions, and I definitely think they are here to stay and should be here to stay.
Thank you, Danielle. Andrea.
Thank you. Yes, I mean, I agree with everything that's been said. I think, you know, we certainly at GSK, we believe that the innovation and the change that we're seeing is here to stay. It's a good thing, and it will help hopefully to reduce the demand on healthcare professionals' time. Also, as Shakila's mentioned, help reduce the burden on patients' time, which will hopefully also have people who don't normally access healthcare access it more frequently. So certainly health technology has its place and can support in the overall delivery. I think, as other people have mentioned, it's flexibility and choice that's going to be key as well.
Thank you, Andrea. And I really like the fact that we've ended on a fantastic point, Andrea. The idea that it's about flexibility and choice, and I really echo that from my own perspective. So thank you. I want to thank the speakers for your contribution to today's event, and those of you who are watching and those of you who've contributed questions, thank you very much. I also want to encourage all of you to share a link to this event to your colleagues, who can then register and watch it on demand. There's also a feedback button which is going to appear at the bottom of your screen, and it's going to ask you for feedback. We will send out a survey link in an email shortly as well. Please, 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 can you take the time to fill this out? We really value all the feedback you can give us, because that helps us to continually improve and develop our events. So please give us any feedback you can. And finally, and once again, I want to thank our sponsor, GSK, for enabling this event to take place. Thank you very much, GSK.